But that is
Yes.
bought over now. The company sold out.
Yeah, it is sold out to some. No, Thermo
So
Fisher is
Thermo
there.
Fisher bought Chiron.
Yeah, correct.
Yeah.
Thermo Fisher now is acquiring
They
so
are the
many
big
companies.
guys.
So Thermo Fisher, if you need to know somebody in India and the top level, let me know. One of my close colleagues has joined there.
It's
A
frozen.
warm
Thank you.
welcome
Yeah.
to all our viewers today. I'm really excited.
Hello.
One of our, this is, I think, around the 6th or 7th COVID chat we are having. And I would have imagined that the questions would not come rolling in the way they did. I thought, in fact, I was nervous while fixing this today. I thought, I hope I'm not doing an overkill. But I was so excited to see that people are just waiting and wanting to know more, to feel on top of this situation. Because I think something like this makes you feel very, this is a novel virus. No one's seen anything like this ever, at least in our lifetimes. Right, Ashish?
Yes,
And,
absolutely.
and
Not in
I think
humanity.
absolutely, Ashish. And people are just so flummoxed that I saw an overwhelming response. I had something like 200 questions, which I had to sift through. And I'm really excited to have you all here. Like I said the last time, you are the reason. My friends, my colleagues, my batchmates from Los Angeles, my colleagues from Paris, the people I worked with in Sydney and Brisbane in fashion, all my colleagues from Harsha Trust in Bissam, Cuttack and Orissa, my batchmates from Hindu College in Delhi and from the Delhi Public School, and of course, my Bombay Women Achiever Forum and the ISKCON sisters who I hold very, very dear. All of you are the reason that I keep doing this again and again to try and make some sense. And God has been so kind to give me friends that are here with me today. And I have to say, without sounding immodest, that they are no ordinary friends. I mean, today is a very epic day because Dr. Shashank Joshi, you already know him. And you already know that he's been spearheading the task force, the COVID task force. But a very special piece of news for you today. He has been declared one of the top 5% of doctors, performing doctors all over the world. So a big
0.5.
0.5. That's even bigger. That's great. I mean, this is really big. So a warm congratulations.
5%,
and of course,
not 5.
0.5% of doctors from the top 5% of doctors internationally. And that is not only a proud moment for all of us, but everyone in India. I think it's very, very, and you know what is enthralling is his generosity and his level of sharing. I mean, I just made one call and here he is with all of you and with me to share information. But I must also tell you about one of my best friends in the world, that's Suchetan Pradhan. Suchetan is a speaker at Harvard Business School, apart from being a Harvard Medical School, I apologize, apart from being the promoter, founder, and mentor at the Pradhan Dental Clinic. Now, you all know that Pradhan Dental Clinic is one of the most famous dental clinics, which is known to give the Miss India smile to the past so many Miss Indias, but also the entire Bollywood fraternity. And a little secret, he has a top-notch an A-class hero sitting on his chair right now. So I have had to wean him away and tell him that he just can't go there for, right now he's promised to be with us. Dr. Ashesh Bhumkar needs no introduction. He is the head and the founder of the Bhumkar Hospital. He is somebody who's very, very compassionate. He gives ears to children born without ears. What was it you called it? The operation?
Microtia.
Microtia. And he sent me a beautiful picture today of a ear that he has reconstructed, and I'm going to try and find it and show it to you. It's really heartwarming what he does, and I must tell you, I'm a first-hand. I've experienced what a generous. In fact, he and I brainstormed the questions today together. So he's such a generous person, and he's one of the people who I do this chat because he's there mentoring me right through. So this is the ear. I wonder if you can see it. he's reconstructed this young child's ear, and it's a work of art. Dr. Ashesh Bhumkar, you're an artist, in my opinion. I think you're an artist. You're a sculptor. And I think we are all very, very proud to, let alone have you as such a close friend, but even know you. It's an honor and a privilege to have you here today, Ashesh Bhumkar. Dr. Shalmali is a very well-known microbiologist and is going to throw a lot of light for, questions I get every day about RT-PCR and antigens. And she's very kindly agreed to come on board. And I think, Shalmali, your clinic is called Molecular Labs. Am I right?
It's a lab, yeah.
Yes, it's Molecular Labs. And Dr. Shalmali is going to throw light upon a lot of questions we have about testing. And last but not the least is Iqbal. You don't see him, but she's screen sharing with me, and he is the tech expert who's handling the forum today and making sure that we are streaming live across 10 different social media forums. So thank you, Iqbal Ghani, and anyone who wants good social media, he's a go-to person. So just write in and I will share his number with you. I am Nisha JamVwal. I'm not only a friend of yours, but I'm here to handhold you through this period, this difficult, dark period that humankind is facing. Let's see this together. Let's go through it together. And I promise to do many such brainstorming sessions with the best of the best, especially because I have Dr. Ashesh Bhumkar by my side. So on to what we are here for. I don't know if a lot of you may remember that Shashank Joshi was with us around. Shashank, I think it was 7 months ago, isn't it? So 7 months ago, things were very, very different. Though we had a similar chat with you, we had many doubts back then. What have we learned so far over these 7 to 8 months? In March, we commenced a very unprecedented, a very strange lockdown across the world. What have we seen which has changed since then?
So Nisha, first of all, congratulations and thanks for having all of us here. And it's awesome that you're doing these educational activities. And I must put on record my special thanks to my good friend Ashish. And of course, we have Suchetan, who's a wonderful human being. And of course, Shamli has also joined us. So Nisha, I think what we have gone in the last 6-7 months is from an unpredictable, fearful death of COVID to a more chronic manageable or acute manageable condition. So we know much more about COVID today. A large proportion of COVID is silent, asymptomatic. Most people who they are not in the vulnerable group are living longer and they are being healthy. So I think we have learned to handle COVID better. And I think all the lockdown did is allowed the medical and the healthcare infrastructure to be built up. But beyond that, I don't think it did pretty much more. It generated more anxiety. I think we are less anxious now. I think we know that we can handle COVID. And I think if you have not got COVID, some point of time in your life, you're going to get COVID. So I think that type of a attitudinal change has happened. So there has been a large sea change which has happened in the COVID world in general. We are in the COVID universe. The whole world is COVIDized. We are still in our first peak, fortunately, in India. We don't have that second peak coming up. But I think we have learned how to manage COVID, how to detect COVID early, how to handle complications of COVID early, how to save lives. We had a very high mortality in places like Mumbai with almost 10% of case fatality, which is now down to almost maybe 1.5–2%. We know how to, manage it better. And I think the large proportion of fear factor has gone and we have unlocked. I think we were all, in our dens at home, at least I could, Suchetan that time also was in his gear, and so was Ashish because they are surgeons. They are born with it, So we were all now, we have gone into their gear now. And I think we have done well. And I think we should be very optimistic. We have the best recovery rate in the world, lowest death rate in the world. I think India has done extraordinarily well despite of a large proportion of cases. Economically, we have still taken a hit, but I think we are there. And I think we have to be very happy that in the last 6-7 months, both our central and state governments have done a fantastic job and the public health professionals have done a job. Now it is the responsibility of citizens, and the citizens now need to do something called as COVID appropriate behavior. We need to behave ourselves. And of course, you are a queen at behavior management. So you can actually guide and handhold people at large, because we need figures like you. now to motivate people so that they can behave appropriately?
Thank you so much. That does make me a little unpopular, Shashank. I was surprised to see at a place of worship recently, no one was wearing masks and there was no social distancing. And it was as if we were in a completely normal period. Is this, Ashish, is this fatigue? Is this lockdown fatigue? Is this sense of complacency when Shashank tells me that, I must be a leader in this movement of behaving responsibly? I do believe that there is a great sense of irresponsibility in, in and around me. In fact, I see people, in shanty towns, in the slightly less privileged spaces, being more responsible. And I see people in their ivory towers having dinners and parties. Is this opening up? Is it part of moving on in life? Is it bravado? Or is it irresponsibility, Ashish? What do you see it as?
Subhash. Subhash level.
I think we've lost Ashish, so I'm going to come back to that question. Ashish, you're back with us? Great.
Yeah, sorry, my signal is a bit weak here. Yeah.
No problem. So you got my question?
No, I didn't. I'm sorry.
Okay, so is this sense, I just said I went to a private place of worship and no one...
No, that part I heard. Yes, sure.
What is this? Is this bravado? Is this irresponsibility? Or is this about human adaptability and moving on? How does
I think it's all of that. It's all of that. I think what has got unlocked is actually the human spirit. I mean, it was locked in for too long. I think the human spirit has never been locked down for such a long time. And it is forums like this, taking the medical evidence down to the social level. I think, and you are the medium for that. Because as medical, we speak between in our community, but it does not really percolate down to the society. Of course, the task force and the government machinery does its best. But I think it is time now for people to behave. And I think we have to start narrowing to the scientific part of social behavior. What happens is you start seeing 100 people on the street and suddenly your mind says, but nothing is happening to them, so why shouldn't I? And if you are privileged, you tend to do it that much more and with that much more scale and pomp. I think that's the only difference. Understanding that the nose is the gateway of COVID-19 and what needs to be protected is the nose and the mouth. If this message goes across, then I'm okay with socializing. I'm okay with a little bit of social distance compromise, little bit. But the most important is that the nose and the mouth have to be covered. I think that is a lesson we've learned. Not so much of these sanitizations, and we had almost gone to paranoid levels of hygiene and the parcels we were trying to do all kinds of things, UV lights. I think that we have learned that the virus is not that easy to jump from a food parcel into your nose. But keeping this, I think what I would have done in March versus what I'm doing now is I keep this really locked in. Everything else is unlocked.
So Suchetan, what is, I've seen you flying around, working, doing operations all over the world. Suchetan, what do you feel about flying? What are the precautions people need to take? Because what Ashish and Shashank are hinting at is moving on. And Shashank is always such a positive and such a, he takes the trouble to appreciate each and every person and make you feel on top of the world. Thank you, Shashank. Shashank, your optimism is, it's infectious and I love it. But Suchetan, what is the precautions you take? How are you going to protect yourself as the world opens up? Especially, I want to know especially about flying.
So, the first thing that we have to understand is that life has to go on. You can't be locked down forever. And this is not a virus. And as Shashank said very rightly, that what we knew 3 or 4, 6 months back and what we know today is there's a vast sea of difference. But as we come out, I think it's very important for people to be disciplined. If they are indisciplined, we are seeing what is happening in Europe again. There's a second peak. In fact, my son is right now in Manchester and they've locked down again. And so that they're seeing, of course, they're talking about a slight mutation in the virus. So, and it's a far more infective virus there. But yeah, when you're coming out, there are a lot of people who've locked themselves in for the last 8 months. And when they come out, it's very, very important that, like as Ashish said, this is something that you need to protect yourself from. And very importantly, the other person who you are dealing with also has to protect themselves from the, cover this part up. Because we know today that the fomite transmission that we were very fearful of in the beginning, which is touching of surfaces, that virus transmission is very, very, very minuscule. What is happening today is a transmission which is human to human. So through your aerosol spread that is directly coming into contact with your nose, your eyes, and your mouth. And so that is something that we will have to be very careful about. It's very simple. Mask yourself properly. And if you're traveling and you're traveling on a flight, for example, make sure that there is social distancing maintained. Of course, on the flight, on the airplane itself, there is no social distancing possible because of the proximity of the seats and your neighbors next to you. But what the airlines are all doing is they are putting HEPA filters in. So what we are also doing in our practices, in our clinics all over, is we are putting UV lights and HEPA filters. We have an air exchange of 50 air changes per hour. So which means that we are actually reducing the bacterial, yeast, mold, and the viral loads to minuscule levels, which are manageable and which do not transmit the disease. The same thing that you're on a flight. Please, 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 when you're taking a flight, make sure that you're masked all the time. Okay. And when you're, of course, if you're taking a long flight, it's not always possible to do that. It's not always possible not to use the loose, but make sure that that is something that you're always looking at. If you're booking seats, the safest seats on a flight are the window seats.
Okay.
And because if you look at the airflow that comes out of the vents, that airflow comes into the aisle mainly, and then it is recirculated in there. But having said that, we haven't heard of any super spreader incident happening on airlines. I don't know whether Shashank, you've heard that, or Shalmali, you've heard that, but I haven't had the privilege of privy to this knowledge. So that's very important to understand. Take simple precautions. Don't panic. Don't be afraid. You will have to have social interactions. It is impossible, because otherwise I am seeing a lot of psychosomatic disorders in patients who are coming out of or still are mortally fearful of COVID. In fact, the other day I had a patient, and I shall not name him, very famous person, who took a charter flight from Bangalore to come to Bombay for treatment. I mean, that of course, if you can afford that's something that one can do, so you protect yourself. But yeah, it's very important to just take simple precautions and don't be mortally scared.
Thank you so much, Suchetan. Shalmali, before we move on, I just wanted to know that Europe is seeing a second wave. India seems not to have yet come onto a second wave. Is this perception true? And is the virus milder in India, or is there greater immunity because of the BCG vaccine?
Actually, this perception, I just can't comment on this, because yes, definitely, I think India will now, it will start after Diwali maybe. The second wave, what they are saying is that second wave might come, but still now, whatever I'm pertaining to lab studies, whatever we undertake testing, it is definitely reduced. The rate is positivity is definitely reduced these days. Maybe awareness of people, or people are using masks. I can say that only.
That's very well articulated, Shalmali. Shashank, can I just come back to you? And something that's been perplexing me personally, you know, when I lock myself at home, and if I'm too ginger about going out, am I less exposed to pathogens? And then am I more vulnerable when, with a reduced immunity, because I'm not exposing myself to the outside world? And something that has been occurring to me is, you know, a lot of us, like I said, in all our obsession with staying healthy, are having zinc and A and B and D and all the vitamins and all the nutrition. And you see that a lot of people from our world are from the charmed circle are getting COVID. And then you see a lot of migrant labor, domestic staff, housekeeping, factory workers roaming around from the inner cities and states of India, roaming around in crowded trains and crowded buses and going up and down the country and absolutely free from the virus. Do they have better exposure to pathogens and therefore better immunity? And nutrition doesn't play a role, a part in staying healthy, because this seems to be completely at odds with everything that you seem to move forward with.
So, Nisha, this is a very key question. I think in the good old days, there was a hypothesis called hygiene hypothesis. So
Yes.
people felt that you can have, when we grew up, in medical schools, we thought that if you can have a bhel puri on the roadside, and you don't get a diarrhea, which means you have a very good gut immunity. That was the good old days. Okay. Now things have moved, and now people are paranoid. They will have mineral water, and they will, be very overtly hygienic. They will take all those micronutrient mirch masalas, and they will all get them from abroad. They will all be shipped from different parts of planet Earth. But remember three simple things. Number one is that our lower strata of the population, the slum dwellers and all, they already have had a large exposure. They have already had a zero antibody positivity of almost 50-60%. And they already have some T cells and B cells fighting it out. And therefore, their ability to handle disease is better. That doesn't mean that people like you and me or anyone else staying at home, locked in with a paranoia, as Suchetan very rightly said, that people have actually, we need to move on. But the point is that they have weaker immunity. That's not technically true, because this is a very dangerous proposition. What happens is that you see that led to a very, very sadistic thing in United Kingdom and Sweden. They felt in the good old days, in the flu era, in the common cold era, they used to have virus parties.
Right.
I got flu, you got flu. You throw a nice party. You are famous for parties, Nisha. So you throw a party around and you are on the page 3, and then everybody gets the flu and they enjoy it and they get immunity after that. That was the old concept of herd immunity. And then 60-70% of the population gets it. We are good. That has failed in COVID. And that is something which we need to remember, because COVID hits hard only in a particular strata, which is called as the vulnerable group. Which is that vulnerable group? People above 50-55, people who have comorbidities like hypertension, diabetes, heart disease, lung disease, any major disease or any major medications, to make it very simple. If they have that, whether you are from a jhopatpatti or whether you are from a skyrise, you are equally vulnerable to die. See, we need to save lives. That's the bottom line. So that vulnerability is still there. But the point is, most people in the lower socioeconomic strata already had exposure. So even if they are going again and again, it's not going to make a big deal to them. But that will last only for a season or two. So their antibody levels also, worldwide studies have shown, they decay after 3 months or 6 months. So don't be very sure that somebody who's coming into your house like a maid or a driver who has already had COVID and has some antibodies is absolutely safe. He's equally vulnerable for a reinfection maybe after 3 or 6 months.
So
So
are
that's
you saying
something.
that once the body is familiar with the virus, the second virus attack is less exacting because people...
So we are only in the third season, Nisha. So we are only understanding better about this tricky, predictably unpredictable virus. So I think if I say something, I would be wrong. Though I'm a scientist, I would tell you we probably are looking at that it is likely that the second infection may be weaker, but we have had very, very few cases of reinfection. So reinfection is exotically rare. So again, don't get carried away. Just like what Suchetan told us, flying on air is one of the safest things. Actually, it is much more safer to fly on an aircraft, okay, than actually probably going into
It's a
a
car.
crowded environment, Okay,
Right.
so that's much more, because you're absolute, and the circulation in the air is pretty good. So it's very low probability that you will have it. But going into a restaurant, when you unmask yourself, okay, whenever you unmask yourself, or when you're talking, when you unmask yourself, or when you are unmasking will make you corona vulnerable. And that's something which we need to recognize, and we need to be extremely categorical about. So that is what we need to do. So we are getting immune, no, but we are having a large exposure. That antibody, how long will it last? We don't know. Whether there'll be T cell immunity, we don't know. Will it lead to auto vaccination? We don't know. But one thing is sure, that a large population is going to be protected for at least 3 to 6 months. That thing is very clear cut.
Shashank, you spoke about each and every one eventually getting the COVID virus. But some of the alarming things one is reading about is very long-term repercussions over 6 months to a year. The levels of exhaustion, the organs of the body getting attacked, having a sudden collapse and dying just when you're checking out of hospital. It's the seeming recovery of a patient seems to be, alarmingly fraught with a lack of predictability. How would you explain this?
I think there's a little bit of complacency there. That is called as hypoxia. Most people, they get a few symptoms in the first week. They feel they have become okay. And then they're walking home. That's where the 6-minute walk test comes in. You do the 6-minute walk test, do your saturation. If your saturation is falling down, you're not good to go. Second week is very unpredictable. So in the second week, if your saturation is down, stay in the hospital, take a blood thinner, like a low molecular heparin or something, and stay put in the hospital till your doctor tells you to go home. Because you can get sudden death there. So it is the second week where we call happy hypoxia. That means the person is absolutely hate and hearty. There are no symptoms and suddenly they drop dead. And what is happening now, the biggest problem in Mumbai city, which I'm seeing, is people are not testing. Even if they get symptoms, they're so scared of the BMC that they start self-treating themselves. And the first week is already gone. And then by the time they really become symptomatic, it's a little too late. And they are rushing very late to the hospital. That's something which we need to circumvent and prevent. That's something which we need to recognize, that we need to ensure that we catch them early. So hit hard, hit early, treat early. And second week, don't be complacent. Do a 6-minute walk test, do a brisk 6 minute, do a saturation. If the saturation drops by 3% or more, or if it is below 94%, stay put in the hospital, stay connected with your healthcare provider. You can manage yourself very well at home, but stay connected with your healthcare provider. That's crucial. Take some blood thinners. Sometimes if you need oxygen, then you need to be in a hospital. And if you need steroids, you need to be in a hospital. Otherwise, there are very good drugs which are available. Most drugs are pretty okay. So the second and third week are crucial, particularly if you have high comorbidities. And anybody above 30 years is equally vulnerable. See, I've seen people between 30, 40, 50, they think that, okay, nothing will happen to them. But they may have just hypertension. They say, मेरे को थोड़ा सा blood pressure है, मेरे को थोड़ा सा sugar है. But sugar hypertension means big red signal. You have to mark yourself as red, and you have to chup chap घर पे बैठो. I think you need to really recognize that people take hypertension, blood pressure, and diabetes very lightly. And I think they are clear-cut high risk for COVID. So that's what we have seen, that anybody about 30, 40, if they have hypertension, heart disease, or diabetes, be very, very vigilant with yourself. It's vigilance, nothing else.
So Ashish, would you agree that one should have a junior aspirin?
I want to say, trust your doctor. Use all your intelligence, use all your resources to find the right doctor you can trust. But when you find him or her, then don't question. A lot has happened is doctors are unnecessarily keeping you in the hospital. At one end, this is the problem. At the other end, at discharge, if somebody is having a mishap, it is seeming like he was not looked after well or was discharged prematurely. So doctors are in a very tight situation. I think the media and the general image of a doctor, I think it needs to get truly rectified to its realistic level. No doctor, no hospital wants to keep you longer than what you should. So use your intelligence to find the doctor, but once you find him or her, do not question their decisions. I think is the real health mantra that one should follow.
So you said that last time, Ashish, and a lot of people questioned me as to how do you know when somebody is the right doctor? How do you find the right doctor?
Yeah, it's a bit of a...
a lot of doctors, Ashish, who were your regular doctors are no longer taking on COVID patients. So how does one now go around looking for a COVID doctor if you get COVID? For instance, if God forbid I was to get it, how do I find the right doctor to treat me?
So you have the biggest doctor right now on your screen, Shashank, and not, of course, everybody is as privileged. But one has to use it, just like you navigate life. Just like you navigate success and every other non-medical aspect of your life, you do navigate through it. So one has to be smart and start finding a way. There's no one formula, but there are people like
Like you
Rahul.
said, Ashish, last time, you said that you keep the
Three-layered.
3 layers ready from the beginning, be prepared,
Correct.
and something that Shashank said, I'll intertwine with what Ashish and Suchetan have said, that everyone's going to get it sometime or the other. So be prepared, keep your ready reckoner, list your 3 numbers. Ashish, the 3 numbers was your GP.
Yeah, MD physician and then the COVID specialist.
Correct. So these 3 doctors, guys, please keep your numbers ready, on your bedside, on your post-it. Be prepared. And like Shashank said, you're going to, want to address this earlier than later, which brings me to Shalmali. Shalmali, when after a public exposure, I'm
Yeah.
told 5 days, but I want you to corroborate. When after you feel you've been to a spot which may be dangerous, or you feel a scratch in your neck, or you feel the beginnings of exhaustion, when do you test? Secondly, explain to us that should one first do a rapid antigen test and then an RT-PCR once there is some indication, or does one go straight for RT-PCR, or does one, to be safe, do a rapid antigen and RT-PCR? And what is the time when you do this?
Okay. First, I'll tell you that this COVID virus remains viable for 72 hours on plastic and steel, stainless steel. Whereas for 24 hours, it will be viable for on cupboards, wooden cupboards, tables, door knobs, handles, all such things. So there you have to use your gloves or something. I'm talking in whenever I'm working in a lab, that scenario. But then, as you asked, that antigen test is mandatory or not, as per ICMR directives, ICMR has made clear to everybody that you have to do antigen test. If that antigen test comes negative, then you are supposed to do RT-PCR. When it is positive antigen test, you get the result within half an hour's time. So if antigen test comes positive, then you are positive. You have to admit yourself to the hospital or stay home quarantine. That depends on your condition. But when antigen test comes negative, you have to do RT-PCR test. Why? Because antigen test compare it as compared to RT-PCR, it is less sensitive. Whereas RT-PCR is around 96 results they show that, or assays whatever they give us, is 98% sensitive. So there are more chances that if you are missed in the antigen test, you get correct results when you are doing RT-PCR tests.
Okay, thank you.
Nisha, I can simplify that.
Please.
If there's one test that you want to do, it has to be the RT-PCR.
Yes, that was the answer I was looking for. That was what was confusing everyone. And just to build up on this question, a lot of staff, a lot of labor, a lot of technicians working in dispensaries are returning today. So if one was to do one test, it would be RT-PCR while re-employing people, right?
Yeah, right. Because reports of RT-PCR are accepted for traveling, say for giving exams, everywhere only they consider RT-PCR reports.
Okay, that's fabulous.
Just one point on that. Sorry, Nisha, just one point on that.
Yes,
if you have to do repeated tests, Shalmali, some people are, in professions which expose them, they are in crowds and, things like that. Would you recommend doing an RT-PCR repeatedly, or would you do an antigen first, and then if it is positive, then you would do it?
No. Actually, say if you don't have symptoms or you don't have fever for last 3 days after onset of infections, and when you are tested positive initially, then no need to do the test again. Antigen test is out of question, but RT-PCR is also not required to be done.
That's because there's a lot of confusion. and
No,
people
there
are
is.
secretly doing tests. This is a
So
good
as
point that you made because, yeah, sorry,
yeah,
go ahead.
this is as per the latest guidelines which is given by ICMR. You don't have to do test again RT-PCR. If even if you want to repeat, you can repeat RT-PCR, but not the antigen. And in my experience, in the lab experience,
Unmute.
what I found that even after say 14 days, if patient is fine, if you do the RT-PCR test, it comes to be positive. So that viral, that shows that the viral shedding is not stopped yet. Maybe it is there, that is why but you are all
Shashank should
right.
explain this. Shashank, for the common man, please explain what Shalmali is saying. Unmute, unmute,
Your,
unmute.
your, your, your voice,
Okay.
voice.
Sorry, I muted myself. I think both of you all make very valid points. I think we are doing the too many tests, and people who don't need get most of the tests, and people who really need don't get the tests and they spread. That's the big problem. So it's like catching a needle in a haystack. So what are the simple things? Number one, gold standard RT-PCR, 70% positive, 30% can be negative. If you're asymptomatic, you're okay, but be vigilant, because that person who is so-called tested negative should not feel कि मेरा negative है, मेरे को कुछ नहीं है. Be careful, that's all. At least for a week more. So 7 days after that. For example, you got a servant, a maid, a driver, or anybody else coming at your house, RT-PCR negative, but be vigilant for 1 week. Mandatory masking, mandatory sanitization. That's something as a rule you should do. That's something which you need to do. Antigen test, quick turnaround time, as Shamili said. Within 1 hour, you get a result.
And what is
If it is
this?
positive, it's like a screening tool. If it is like Suchetan wants to get somebody in his clinic, he can't tell everybody to get a COVID RT-PCR. Somebody has flown down from Bangalore to see him. He's going to think that he's going to take universal precautions and going to take care of them. But the risk is more to Suchetan than to the person who's coming in. So the point is that then sometimes the antigen test is done outside a clinic and in a hospital or in a casualty. If it is positive, we know that we need to take full gear. If it is not positive, we are still going to take appropriate care. And the third thing is, lot of people have started also doing something called as antibody. If the antibody is already positive, we know that this person is already exposed. It's unlikely that that RT-PCR will be positive. That is the third thing. Fourth thing is, lot of people who have symptoms, RT-PCR negative, antigen negative, do an HRCT scan, because you see sometimes, so it all depends on whether you are symptomatic, asymptomatic. If you're asymptomatic, screening, RT-PCR, close the matter. But for 7 days, be having proper COVID appropriate behavior, mask. I'm still telling you, the strongest vaccine, the strongest therapy for COVID before getting COVID is masking. If you mask, the person who is already carrying the virus won't spread it to others, and the person who is exposed to that person is unlikely to get it. That's all you need to do. And that's what surgeons are doing. That's what surgeons like Suchetan or Ashish are doing. Ashish and Suchetan have been living in their gowns and in their masks all their lives, maybe for 30 years, 35 years, 4 decades. They have just done that. They observe that hygiene 24/7, because there were viruses before COVID also, but they were probably not as infectious as these. And I'm certain, because of the hygiene they have been observing in their clinics, whether it's a dental clinic or a ENT clinic, they have the highest exposure risk. So that's something which we need to record. I hope I have made it very simple and clear.
Nisha,
Yes, but there is a question on.
just to elaborate, that 7 days is the time that if at all you were to develop a symptom, you are going to develop in the 7 days. That is why Shashank is saying that is the sanctity of that 7 days after you have tested negative. So in case you develop, you are likely to develop a symptom in those 7 days. That's it.
Actually, and so when a person is asymptomatic, when is it safe? Sumita wants to know, when is it safe for all the family members to go out and meet others in case they are asymptomatic?
Whether you are asymptomatic or symptomatic, after a week you are safe to go. Wear your mask, be appropriate. As long as you're appropriate, you're good to go.
So that brings us to the very important point about antibody, Shashank. A lot of people who've tested, who had COVID and are antibody positive, they again keep testing for antibodies. At what point and how many tests should they do? Because that's a question that we get asked all the time. And people are getting paranoid and checking their antibodies every week again. So again, that's something that we will have to explain to the participants, Shalmali and Shashank. I think that's.
So I think Shalmali can explain that. I'll give a very quick answer. IgG antibody every month. Okay, a quantitative IgG antibody every month. If you do, it's good enough. You don't need to test it every week. Don't think that you're going to get a decay of antibodies. Even if your antibodies are zero, you might have T cells which are robust and will fight the virus. So in the first 3 to 6 months, to a great extent, you are likely to be protected. And the reinfection is exception and exotic, and it only occurs predominantly in environments like healthcare workers. So Suchetan, you and Ashish or me are more likely to get it, or Shamili is more likely to get it than others. Shalmili?
The repeat antibody na Suchetan is more of a macho. Oh, मेरा तो 110 है, तेरा कितना है? 60 ही है. Oh, like my body is like a Superman's body. I think that's where people are headed.
140. Today
the
somebody told me,
panel
"Man,
of the
140."
whole.
I said, but be careful. The 140 may come down. So don't be under that.
So a quick question for the entire panel. I have a flood of questions coming up. Shashank, the film and TV industry is very active now. Considering that it's difficult to keep social distancing and considering that it's difficult to wear masks while shooting, while filming, cases are increasing in the film industry. So should the government be allowed to open up the filming and or open up shooting in the film industry?
It's already happened, Nisha. So there is some degree of risk we take. In Sanskrit, there's a saying, padam padam vipadam. That means at every stage of life, you have an obstacle. When you're crossing the road, you can still have an accident, but likelihood of accident is very less. Traveling in an airplane is more safer than driving a car. Similarly, when you're going on a shoot, as long as you are prudent and careful, it is, where the transmission occurs on a film set. It is not when actually the set is on. It is in that small little room when you do the makeup. That is where you need to actually, and when you're crowded and clustered in a closed environment, or when you're having a coffee with your friends, that's the time the transmission occurs. That's the time it happens even with healthcare workers. So you need to ensure that the toilet spots, the canteen spots, the coffee spots, they need containment. And those are the transmission zone spots you need to mitigate, but we have to unlock. Nisha, we can't be not doing it. There will be a little risk and we have to take that calculated risk, but we have to do reverse isolation. So somebody is about 65, somebody has a bad heart disease, bypass surgery done, angioplasty done, diabetes, hypertension, and those people I would avoid. But rest of the people pretty much are good to go. Even if they get a little bit of COVID, they are going to be asymptomatic and they will recover on their own.
Great. So that's a very optimistic and great. I mean, it's just about moving on.
I want to add to it one more. I would like to add one more. This COVID virus is an envelope virus which has a fragile outer membrane, so which is less stable, and it is very sensitive to the oxidants like chlorine, which we use. So by using sodium hypochlorite, we say bleach. If you keep the clean environment, I don't think there is a possibility of transmission.
That's a great input. So where does one use this bleach? On surfaces?
For floor, for cleaning of the table surfaces, and for
so how does one, or in what form would the layman be find this bleach accessible? What is the
these days Lysol, the disinfectant Lysol, which is available, you can use that Lysol for cleaning your floors and the tables and the furniture surfaces. That way you can get rid of this virus.
Very good. Shashank, looking at this scenario of masks, and can social distancing be seen as a necessity? I mean, is wearing a mask enough, and social distancing not as important as wearing a mask if we were to look at the two?
So there are no shortcuts in medicine. So the distancing of 6 feet has been mandated by a lot of this thing. But because we are in crowded clusters with poorly ventilated environments, their distancing is important, because if you are in an overcrowded environment, then distancing becomes impossible. Masking among all of them is the best. After masking probably is the distancing and sanitization both. But many places, distancing, for example, if you're traveling in a crowded local train or a bus, distancing is becoming a difficult proposition. But we don't become fatalistic. See, what I'm seeing is extreme behavior pattern. And people, think that ki, jo hoga, hoga. That is wrong. If you can distance, stay distant. Okay. And that happens in casual conversations, casual parties, and casual, meetings. So I think distancing is important, but now that the fomite is not as high as the airborne. And also we know that in a crowded, poorly ventilated room, if you are in a claustrophobic room with the only air conditioning, no open air, then your risk of transmission is very high. If you are in open air, you are going in a garden, I don't think, the distancing might matter, but masking will matter. So I think it's important to be using common sense. COVID management, Corona care is all about common sense. And we know reasonably enough that we should not be, reckless, irresponsible. At the same time, we don't have to get paranoid and panicky. I think we need to get that right middle path and do it right and be ready if something happens.
So what did
Nisha, sorry. See, there are situations where distancing may not be possible, but I cannot comprehend of a single situation where you cannot be masked. So you always have the option of being masked, and therefore you should always be masked. Social distancing, depending upon where you are, is not necessarily in your hands, but the mask is completely your responsibility and in your hands.
There's one point. If both people are masked, the chances of transmission are 1.5% only. If you don't maintain social distancing, if you're masked and social distancing, then it's 0%. But even with masking, it's only 1.5%. If both the mask, and very important, please don't wear. I see a lot of people wearing masks like this. That is not a mask. That is covering your chin. That's the chin up. Okay. What is masking is this. And make sure that everything is masked from the sides. There is no air.
A lot of people, please show them how a lot of people are covering the mouth, and not the most important thing. Please show them that what we discussed on Saturday night.
Okay, so the best thing to do is to wear a mask which has got two straps rather than one which goes behind the ear. If you do this, or if you have something that you tie behind your back, then you put it over your nose. Make sure that you clip it over your nose so that there is no escape from here, and there is definitely no escape from here and here. And look how well-fitting this is. And people say that I can't breathe. We've lived all our lives as doctors with masks. We've not died because we have not been able to breathe. It's just a matter of getting used to it. It's very important.
That's very. So, what is the precautions to be taken when somebody has a stent or two in their hearts? What is the extra precaution Mr. Kanoria should be taking?
Shashank.
I think he has to be more, as long as he masks appropriately, goes in open air, does his work appropriately. I don't think there is any major challenge, but one doesn't have to be foolhardy. If you are into a comorbid condition and if your age is say 75, 80, it is better to stay at home and do a lot of work virtually. And if you want to go out, ensure that you go into open air environment rather than going into crowded clusters or poorly ventilated spaces. Remember two words: crowded clusters or poorly ventilated environments. As long as they are avoided, the risk of transmission is less. Now, a crowded cluster or a poorly ventilated environment may also make lifts. See, many of us stay in high rises. High rises have very, very narrow lifts. And sometimes, in that lift, only ideally one person should be traveling. If you crowd that lift, you have a high risk of transmission. A lot of high rise transmissions we have seen in Mumbai have occurred actually because of the lifts. So you need to be a little more patient. So somebody like Mr. Kanoria has to be more cautious and careful. That's all. It's caution.
Very important. So Shashank, a person who's crossed say 50, would it be advisable to have a junior aspirin once a day, just to make sure that your blood is?
No, I think it has to be done under medical advice. Just don't do it blindly, because it's important to do it. But I think it's important to have your friendly neighborhood doctor telling you what you should do, because everybody may not need an aspirin. If he's going to see Dr. Bhumkar or Dr. Suchetan, I don't think they like these agents, because they need to stop it before any of
Before
their
any
procedures.
surgery, yeah.
And also remember that some of these so-called blood thinning agents can actually be fatal, because they can just bleed. So you need to be careful. You need to have a friendly neighborhood doctor and do it. Just don't take it up just because I'm above 50, I should take a pill. No, I
It's
think
not
that's
a blanket protection.
I think if there's a family history, your lipid profile is abnormal, your heart has an issue, you have some sugar problem, then under some medical condition, if you have, then there is a compelling. See, there has to be a compelling reason. Okay. See, unfortunately, what has happened is there is a lot of Google, WhatsApp, empirical science which has got generated. So people are just popping pills like they are popping. They would have never popped so many pills in their life. As much of vitamin C they have popped in, and as much of vitamin D they have popped in the last couple of years. I can see Suchetan smiling. But
And that's the point we made earlier, Shashank, about the domestic labor returning from the smaller towns of India, who've never probably had a vitamin in their lives and are not getting infected at all because of a high immunity. So one concludes that it really doesn't have much to do with nutrition as much as immunity. So what defines immunity then?
So I think it's very
That's a
difficult to define.
Nobel Prize winning question.
Nobody knows, but it's a T cell response, and probably we don't know it yet. But I think every virus on planet Earth will have some inbuilt immunity of your body, and I think we will have a good immune quotient. I feel India, Mumbai, and Maharashtra might be the first place on planet Earth to develop some form of mild herd immunity. I mean, that's the feeling I'm getting, the way things are. And if we are able to avoid that second peak, okay, probably till June, Jan or Feb, which is likely to happen, I feel, in Mumbai, I think we have an outside chance there. So Nisha, you'll have to forgive me. I have to go on CNBC Awaz.
But let me say the credit goes to the task force, and more
No.
importantly to our the chief minister, who's very scientific in his acquiring the knowledge and translating it. I think there's a lot that happened in Maharashtra which was a little different. Let me just 2 minutes, Shashank, before I say bye. For the organ that I love the most, people wearing masks are injuring the back of their ears with this elastic strap. I wonder whether people know about this tiny device where you hook the bands of the mask in this and not behind your ears. So it rests on the back of your head, and it does not put pressure on your ears. There's a lot of people are getting injuries at the back of the ear. So this is a very simple 5 rupee device.
No, actually only Shashank is leaving. I had told him in the beginning he can go. Yeah. We have some more questions, so we are going to continue. I'm putting this to the...
Nish, just one point I want to make. People are taking a lot of medication because, again, as Shashank said very rightly, Google is God today. So without knowing what your chemical imbalances are, or what your whole blood picture is, people are just popping pills. We are seeing a lot of hypervitaminosis cases that are coming in now because people are popping it every day, and there is a threshold over which it becomes toxic to the body. People should understand that. And so please don't over-medicate yourself in panic. Follow your doctor, trust your doctor, and listen to what he has to say. So, Ashesh, I think it's, what do you say to that?
Yes, absolutely. I mean, that there's no compromise there. It's medicine, it's health, it's not yeah.
I have a question for the entire panel. There is a lot of ambiguity about food. Would we be right in assuming that ordering food from out and heating it, say in an oven of 100 degrees centigrade, makes it safe? And when you go to a dinner or to a wedding, is it safe to eat there? And the third thing is, a lot of people are trepidatious about raw foods. So is raw food avoidable, as in favor of cooked food?
Shalmali can take about the food being heated at 100 degrees. What is the heat threshold of the virus?
Actually, virus remains viable even at that temperature. Virus remains viable because once virus enters in the human body, it will affect the cell, epithelial cells, ciliated cells.
No, on the food that you order, suppose Assuming that there is virus on the food and you eat it, will it die?
Till now, I have not come across with
There is
such
no data. There was some talk about 52 degrees centigrade being the magic figure, but I'm not sure how true it is. I don't know whether there's any scientific data, but it's more hearsay. But by and large, I don't think food is carrying it. Otherwise, this would have spread at an exponential rate.
So may Jai Talwar eat at a wedding?
Yes, I think so. Not from the fear of COVID. It's not so much from your alimentary tract, because if it goes into your stomach, it's going to be destroyed. It is the respiratory lining that I think is the main thing. So I'm not very sure, but this is my medical sense telling me that it is not from the food that you eat. You don't catch the virus from there.
And if a person's blood sugar is in control when he's a diabetic, is he still a high-risk person?
Not really. Not really. It is for those who are not.
With hypertension, when you're having, for instance, if a relative is having medicine for BP,
and under well good control,
a very good control, walking, living a perfectly normal life, would he also be, considered a high-risk person?
No.
So there's one point to this. We know today that the fomite transmission is much, much lower or minuscule. The fomite is surface transmission is much lower than airborne transmission. This is basically an airborne virus. So food, I don't think it's really that much of an issue. People are very worried about eating salads and stuff like that. I know people who are keeping them in UV boxes, who are heating them up to a point. But like Ashish said, 52 degrees was a figure that was bandied about at one point of time, that the virus is decimated at that point of time. So I think eating food out in restaurants is I don't think there's ever been a super spreader event again from eating out in restaurants that I have heard of. So I think it's reasonably safe. What would you say to that, Shalmali?
Yes, it is. You're right. I agree with you. Here, this is droplet infection, so it settles on surfaces. If you touch the surface and you don't wash your hands, then definitely while eating or while touching to your ear, nose, mouth, it will definitely enter in your body.
Okay.
Yeah, sorry. Go ahead.
I want to ask all of you, I want you to address this question individually. What did we know in March? What did doctors propound in March that is different today and doesn't hold relevance today? Would steaming and
the ambassador of HCQ, Shashank, is unfortunately left. They were talking HCQ. And I think that has gone completely off the canvas now. Nobody's even talking about the HCQ. Good, bad. I mean, that is science. Regarding the steam and regarding the hot water garglings, also, I think on a forum like this, let's just say that I don't think they are effective measures. People have been.
And what about drinking hot water as opposed to normal room temperature water?
No relevance at all. It is not going to give you any form of protection. Absolutely nothing. That warm water or hot water touching
okay, let me ask you two questions. What about when you go out and you return home and you want to protect yourself and your family members? It was said that it's a good idea to come home and bathe before you do anything else. Does that hold good? And whatever the answer to that, the follow-up to that question is, what are some measures that people could do besides washing hands thoroughly once you return from outside?
So if you are in a potentially viral loaded environment, and that could be arguable, which could be, what happens is in certain families, I think there's a lot of hugging and a lot of body interaction. So what I find when I go from the clinic, I do take a shower. My son is very tall. When he hugs me, his nose is at my level of my hair. That's why I'm constantly in a cap, which I will throw before I go home. So I don't want the virus to be settled here, and he hugs me and his nose is very close to where it is likely to be deposited. Where I am concerned, I am safe. For the protection of the family, I think taking a shower, and it's soap and water. It's not the heat, not the temperature of the, it's soap and water which is supposed to be killing the virus. So that I think is something which I'm still following about the shower part, but otherwise most not. Especially your dear ones are going to come where their nose is likely to come in contact. That part of the body must definitely be sanitized.
Shalmali, what is your what are your tips about going home from?
Yeah, correct. If once you go home, because you are going out, so you are exposing yourself. You never know where the patient is or where the infection lies. So it's better always to go home and take bath, because that will disinfect your body. That's all. Soap and water is a good combination which will disinfect your body. Not only COVID, but
That
any other.
any additional precautions one can take when going home from your clinic?
So I change my clothes before I leave. So these are the
Suchetan?
clothes. Yeah, sorry. Okay.
Yeah, so let's see what has changed from what we were talking about in March. One is very importantly, as Shashank said, that we know the treatment today and the mortality rates have come down. So because we've had this 6 months experience of treating the patients, today we are seeing less number of severe cases and definitely less number of much lower mortality. So that's great news for us. We know the drug regimen. I'm not going to announce that on this forum because people indiscriminately start, taking drugs which they don't need to take it. That's one. Two, we also know that again, like I'm saying, that the fomite transmission, and that's what we were really terrified of to begin with, and that's why we were sanitizing our hands every 2.5 seconds. In fact, causing more problems to our hands, dermatological issues that were happening then. So that we know has changed. That is not so much. And what was the question you asked me, Nisha? I forgot.
I asked about, is there anything apart from having Ashish and Shalmali were very clear that bathing with soap and water is a basic necessity, which was propounded in March and stands good for today. You go and you're operating each and every day. You are what I would call, you, Ashish, you're like COVID warriors, putting yourself out there in the line of risk. What is this? Ashish says he, is very careful about wearing a cap because his son is he's very, very tall and he doesn't want to put his son at risk. What are the precautions that you personally take apart from having a shower with soap and water? What is something else that you could propound to people who are going out? Because a lot more of us are moving out today and we do live with our parents who are vulnerable, Suchetan.
Absolutely. So I think you have to delineate between healthcare workers because they are the maximum at risk and people who are not healthcare workers. If you look at the healthcare workers, we started off wearing a full PPE with a hazmat suit, which we have discarded because we again realized that this is not so much of a fomite, but a air-to-air transmission, human-to-human transmission. So that has been discarded. You can see me wearing this now, which is basically a sort of a surgical gown. And then, of course, I wear a cap. I'm not wearing it now because I'm not treating anybody. And of course, we sometimes wear 2 masks. But we were doing this even for somebody like an HIV patient before. So we are taking universal precautions, which we did earlier and which we are continuing to do even now. Okay? We were petrified to begin with because of the fomites. And so that has reduced a little bit. But when we go back home, obviously, we always take a shower and we put our clothes even underneath our gowns into the washing machine immediately so that there is no danger of a transmission. I would like studies to be done, and Ashish, this is something that we should all do, is to find out what is the amount of viral load on our costume. Because sometimes I feel that we are also overdoing
imagining,
things. Sure. And I think that would be a great sort of study to do. But
Shalmali can pick it up. Shalmali, I can start sending you my clothes for viral studies.
Sir, actually, we are doing this research on this. How much time actually on clothes, or what is the distance where the virus settles on your clothes if you go out? If you come across with some COVID positive person, what is the intensity and how much is the viral load? And
by when are you likely to come with the results?
Sir, 6 months more down the line.
months. Okay.
Yeah.
So what is your impression with the viral load? Because that's really something important.
Yeah, actually, viral load for to check quantitatively the viral load, there are no standards available currently. That's
Okay.
what I'm searching for. That is the thing. Only one standard, that is gene E. That gene E is envelope gene. It is a screening gene. It's not confirmatory.
Okay.
So actually, I'm in the lookout for standards. Once I get standards, I'll definitely start the quantitative assays. That is in my mind.
Thank you so much for the work you're doing for humanity, Shalmali. A lot of people are beginning to have gatherings at home. They have found that living, for 8 months in isolation is taxing them. They feel stressed. They feel hemmed in. They are unable to cope. We see a lot of people meeting people now. What is your advice, Dr. Ashesh, about how many people is kosher at a time like this? And of course, we know that there should be a certain social distancing and a mask. And we discussed last time that it should not be over meals, which we are all clear on now. But how many people, Suchetan, Shalmali, I want each of you to take this question and apprise our viewers as to how many people would be advisable to have over at your house to tea or for a meet.
As far as you have space, you have to keep that distance. That's all. That is, and then it depends on space, how much space you have. Accordingly, you can ask people to join you, but by keeping the social distance as well as putting the mask on.
Mask comes off. I am guilty of indulging in such social behavior, because we're in the 9th month. Even nature delivers a baby in the 9th month or after 9 months. So it's very logical for the spirits to start spilling over. And it remains for the first 10 minutes, and then one person gets the mask off, and everybody says, "Hell with it, yeah, we are all fine." This is the reality in the social life. No matter how idealistic we speak. But the maximal time that you can wear your mask, even in that friendly home environment, I think that is where you are well protected. And again, common sense has to sort of take over. And one has to be very honest about their exposure or about their symptoms. And I believe between friends, that honesty is a given.
So if you look at it, you asked how many people, but that will depend on how much space you have. I think if you have a large space, then you can accommodate more people, keeping the social distancing of at least 3 to 4 feet in mind. 6 feet is ideal. But Bombay is a place where the spaces are so small. So if you're going to keep 6 feet, you can probably, most people's houses, you can't accommodate too many people. But what we do at home, and we've been entertaining people in small groups of maybe 6 or 7, 8 people at the maximum, we keep the windows open. So there is a circulation that happens. Even you can put your air conditioning on, but let the air circulate. Because we know that the worst situations are closed situations and a fully air-conditioned environment where there is no outside air coming in. So best thing is open your windows. The weather is getting better in Bombay. Most of us can open our windows and have a good time with our friends.
And which then ideal would be a terrace or a garden.
Or even your own living room with a window, a balcony,
Yeah.
If you have a balcony.
So ideal would be open to sky, right? Ideal would be that.
Yes.
Oh, well, that would be ideal, of course, but that's not going to be, commonly possible, right? But if you have a terrace, of course, would be great. But even your own houses, if you open the windows and allow the circulation to take place, you're still reducing the viral load by dramatic amounts.
Well, so, Nisha, we are re-questioning actually. The scientific minds are looking at the mode of transmission. What we were imagining and how it is translating, especially now, these are experiments, right? Train travel, the crowded places, and the scientific minds are looking at what is happening to that group of people. How easily or not easily this is happening. And I don't think it's happening that easily, but we can't take a chance.
Okay, so so am I right in one of the conclusions we are drawing today that we are all in favor of opening up, And we don't need to look at our future new normal as a situation of stay home as far as possible situation. We are adapting to the new normal and trying to chug back to normalcy. So am I right in assuming that the sticker that you see on all social media, stay home, stay safe, that is now beginning to sound obsolete, and one has to chug back to the new normal? Am I right?
Yes.
Is that one of the
Yes.
conclusions we are drawing today?
Absolutely.
Sorry, go ahead, Ashish. Sorry,
So wear your mask and dress in your common sense. I think that is the
just a little addition. A lot of people were scared to go into clinics, and because they thought that this was an area where, but if you have a practice, I'm sure Ashish will agree with me on that, which has got like we have in our practice, we have HEPA filters, which is what we used to use in the OTs. It's a very simple device that you can use. You can use UV lights to clean the environment, and you have these air exchanges that happen. Then your clinics are very safe. In fact, we feel safer in our clinics sometimes, in our practices sometimes, than we feel outdoors. And this is what I've told you even earlier, Anish. And so that fear, we have to start leading normal lives, because the economy cannot flounder for much longer than what it is already doing. And so I think it's important that one starts leading a normal life.
So 8 months, or was it 7 months ago, Suchetan, you did a fabulous presentation right here on this forum about vaccines. I want to ask all three of you, what is the status of vaccines in India? What is the status internationally? And what is the news of Sputnik? Has it shown, success, Sputnik? The vaccine coming out of Russia?
So I have to confess, I'm not following the vaccine. Shashank was to take that question. I think he's the academic. I have no idea. My gut sense says that we are far too away from it. I think it is too complex a virus for a vaccine to simply be a
yeah.
Okay, I have a question for Shalmali on this. Shalmali, my question to you is, if you have a mutating virus, can you have a broad-based vaccine which can cover all the mutations?
No, that's what. If the virus is, no, it's like HIV. Why HIV vaccine is not yet come? This is the reason. The same thing is for COVID.
Absolutely.
And even if you get there, that is why they are trying 3-4 different sites, regions, to make a vaccine, to create antibodies about from COVID-19. But still, you don't know even after phase 1 trial, how many antibodies will be there and how long they will remain in the body. That is under question.
So again, coming to the question of vaccines, Nisha, I think we are far away from a vaccine. Whatever the optimism shown by a lot of governments and a lot of companies, there may be very, very many political reasons for that as well. So not going into those political reasons, I would say that let us not bank on the vaccine. Let us get our social habits to a point where we stop the transmission rather than waiting for this utopian vaccine to come into the picture.
Okay. So basically, move on with life, do whatever you have, whatever are the, things that we already know, which we can do. And like all of you have continuously reiterated, the best vaccine is the mask. So that brings me to something we discussed, Suchetan, on Saturday. There is a lot of confusion about masks, cloth mask, N95. What are the masks that you say are the safest for the common man, for the layman who's not handling medical emergencies to walk out in? Is a cloth mask with 2 layers safe?
It is safe. So what we use is a 3-ply mask normally. All this time we've been using that in our practices, and that is safe. But if you're in a crowded place, I would recommend this, which is the N95. If it's a crowded place. But if it's not a crowded place and you're with you can maintain some area of social distancing, then even a 3-ply mask, even a cloth mask is safe in that respect. But again, if you are in a crowded space, then I would recommend for surety just wear an N95. And these are available, manufactured in India. The costs have come down quite dramatically. There are some masks manufactured in India, N95s, which are available for as low as 15 rupees a mask, and you can wear it maybe three or four times, and then you have to dispose that. So the costs also have come down because the manufacturing has increased quite substantially.
Can I direct this question to Shalmali? Shalmali, what exactly is the mask doing to this virus? So because I think looking back, the cloth mask seems to be working.
It is working because you can wash that. Whereas if N95, if you take that, you are supposed to use it for 4 days, then you have to discard. If you use cloth,
at the level of filtration is concerned, where the possibility
it's very
of
good,
virus...
but N95 mask is actually generally used in the clinics, in the hospitals, in the labs, where you have direct contact of patients or patient samples. So
but
there
N95 cloth mask filters out, keeps the virus away when you wear it.
Yes, it keeps the virus away.
So that's it.
So it's double cloth mask will help definitely.
But it has to be a double cloth mask.
Yes, double cloth mask.
Yeah. So a lot of people are wearing. Yeah.
And you can wash it.
So unless you're going to a crowded place, friends, or unless you are in a medical, scenario or in a medical environment, you don't really need an N95. Apart from what Shalmali says about safety, it's also very environmentally friendly to wear a cloth mask. And may I add that if you are wearing a surgical mask, please remember to cut off the sides so that they are not reused. That's very important to bear in mind, because we find a lot of people are reselling some of the masks, so that really makes them very unsafe, isn't it? Shalmali, I have a really quick question. Can you explain to me what is the actual processing time of a swab sample in your lab? And why does it take 24 hours to get a result? That can be very, earth-shattering for a person waiting. I've been there.
That's true. Okay, this is a key question here. Everybody is inquisitive about this question, that why you take 24 hours or more than 24 hours. The reason is that actually the test processing time, when you get the sample in your lab, it takes around 6 hours.
I see.
But we have kept that buffer time. See, if the sample reaches by, say, 8 o'clock in the morning, definitely you will get the results within 6 hours. But if it reaches by 8 o'clock in the evening at night, then you can't give immediately, because every time we are not working 24/7.
And why are there false negatives, Shalmali?
Sorry?
Why are there false negatives? Is there anything like a false positive as well in a COVID test?
Yeah, there are false positive results as well as false negative. False positive results are those, if you give the sample, your results are positive, but you don't have any symptoms. That is called false positive. This false positive results happen due to contamination. Contamination, say you are getting the sample, you are processing them. This processing consists of 3 steps. First step is extraction. So there you have say so many 50 samples or 5 samples for that. Even if one sample is positive among those 5 samples, if you are not in your proper mind to work in work, then what will happen is that by mistake you will use the tip which is used for your that sample, it will be added in the negative. So there will be cross contamination. It is called cross contamination. This may happen if the person is not, the staff is not efficient. Yeah, and that is why we have designated separate areas for processing of these samples. There are PCR, pre-PCR setup, then PCR setup, and post-PCR. So 3, actually this testing, it comprises of 3 rooms with different types of processing. So once you get the sample, that is done in pre-PCR. Then once you take it for your processing, the first step is extraction of RNA, or called nucleic acid. That in that process we have to extract out or isolate the nucleic acid of the virus. Once that, because that virus is, the nucleic acid is the main thing which will be detected in PCR.
I
Okay,
see.
the first, so the first step after extraction,
Yeah.
then we will put it for amplification. As you can see other samples or other bacteria, you can see under the microscope and you can give the result. But this virus, not any virus, is not easily seen by naked eyes as well as under the microscope. You require some special electron microscopy for this. So for
Okay.
this reason, this PCR has been whatever developed, is developed by Dr. Carey Mullis in 1973, for which he got a Nobel Award in 1983. So this is the nothing but amplification or the expansion of your nucleic acid.
Excellent. Thank you so much for going into such depth and being so patient to explain it to us, Dr. Shalmali. Ashish, one thing that we discussed the last time, which I want you to dumb down for people who have not understood. Um, there is still a lot of ambiguity about when does one, I want to conclude with this question. When does one know that it's time to go to hospital? There's a lot of ambiguity about when do you care for yourself at home. And I understand about the breathlessness. I also understand when it's time to, be given oxygen. It's time to go to a hospital when you feel, it's reached a dangerous situation. But I'm still getting this question again and again from a lot of people who attended last time's chat that we had, that how will we know? And when we know, will it be too late?
At a very social, non-medical scenario, I think the single most factor is your pulse oximeter showing your oxygen below 94 and remaining below 94 for a short time or a long time. If it just touches 94, comes up and down, that's not the time that you are scared of. But if it remains persistently below 94, I think this is the time to press the button. Yes, admission
And go to hospital.
like, and this is that, and two is of
So,
course
Suchet,
minimal physical activity.
when Ashish is telling us, for all those people who are still confused as to when does a person know that it's time to go to hospital, because there's still a lot of ambiguity among friends all over the world, and sometimes that one decision is Ashish, sometimes it is a fatal decision.
Sure, yeah. So I think let me rephrase into saying not going to the hospital, but when should you seek medical advice, a very engaging medical advice, and that at a social level, that 94 is the magic figure. There are blood tests which indicate that you are worsening. And the single most, again, at this forum should be CRP, the C-reactive protein. It is one of the simplest tests that every doctor does besides the blood test. That's one test that one should look. Is it rising, and is it rising in multiplying factors? If 5 is normal, if it is 10 or 12, you're still okay. And overall you feel good, your saturation good. But if the CRP starts to jump, it starts to become 30, it starts to become 50, your fever tends to go up 102 and above of it, or it remains and doesn't come under control in the first 1 or 2 days, I think these should be your telltale signs that seek a doctor's advice and now engage with him or her, and then decide, he or she will decide whether you need an external oxygen support and therefore hospitalization, or the oxygen concentrator in many cases. I think that should be the algorithm of decision making.
So the one more little point only to that, very well sort of elucidated on this point, was by Shashank, who said happy hypoxia, and that is very important. But I think very importantly is the moment you test positive, contact a doctor. And because then all the advice will follow. There are a lot of hospitals which are doing this online consultation also. Even if you're completely asymptomatic and you have had some contact with a person and therefore have tested and are positive, I think it's important that you should contact a doctor and then follow what Ashish has just said very, very clearly. And I think that will make a lot of sense. D-dimer could be done also with the CRP. So these are the two tests which will indicate the worsening of your condition along with the
Please contact only one doctor.
Exactly.
There are people who contact 5 doctors. These messages are going, but he said take this, he said take. Don't do that. You're only damaging yourself.
But Ashish, you had said there has to be three.
No, 3 layers. 3 layers. Then the GP will tell you that now you need to go to the next level. This is beyond me. Now go consult a physician, and that guy will say you're getting into complication. Go to a COVID. You don't consult 3 doctors at the same time. It is a layered consultation. When he says, okay, this is now going beyond me, you go to the next level.
I see. Thank you so much. I mean, this has been very, very enlightening. Suchetan, would you like to ask or discuss anything further?
No, I just want to say something to all of you wonderful people. There is a shlok in Sanskrit. Annadanam Mahadanam, Vidyadanam Mahataram, Annena Shanika Kruti Paryava Jivantu Vidyaya, which means Annadanam, which is donation of food, is Mahadanam, is a big dan. Annena Shanika Krupti, only for a short span of time are you satiated. Par Yava Jivantu Vidyaya means for lifetime, the knowledge that you are imparting will be a repository in everybody's minds. So I think I should thank all of you all for a really, really wonderful session. And
I should thank you, Suchetan. This journey of COVID webinars happened over a single malt when you and I decided that this is the need of the hour and we need to go ahead with this. And it was with you that this journey has commenced. And so I think I have you to thank, and I have to thank my guide, my mentor, and my friend, Dr. Ashesh Bhumkar, who's one of the most generous and kind people I've had the privilege to know. You are a farishta, Ashesh Bhumkar. And Suchetan, as you know, you have always been the most wonderful friend a human being could ask for. I thank you both. And Dr. Shalmali, you came and added such important pearls of wisdom about microbiology. You know your subject so well. You are. It has been a privilege to meet you on this forum, and it has been an honor to have you with us today. Until we meet again, I want to thank all our friends and our family who is here, because of whom we have done this little conference today. It's been absolutely fabulous. And right through the session from 4:30 onwards, I've been flooded with questions, and I hope I've answered all. If not, there will be another time. I think in another month, I will do another such session. But until then, au revoir and stay safe. Thank you.
Thank you.
Thank you.
Thank you.
Thanks, Nisha. Wonderful as always.
Thank you so much.
Thank you, Nisha. I'm inspired actually with your now presentation.
Thank you. Iqbal, you can cut off. We can just chat among ourselves.
Yeah.
Went off very well, Nish. Went off really well.
Yeah.
Thank you so much. Thank you. Just stay on. We'll have a little chat among ourselves. I'm just going to disconnect if you don't mind.
Yeah.
Can you send me a request? Yeah. You handle it. And so we are offline now.